it's always which is worse. Um, Left untreated, depression is a very high predictor of suicide, and that's why I want to talk about that first. So depression, when someone comes to me with saying I feel depressed, well, that's not enough. I'm going to be looking at their history, their current symptoms, their appetite, their sleep, changes in mood, behavior, whether weight loss, weight gain, sleep. Are they having thoughts about death? Are they having thoughts about suicide? And depression does not just come on very quickly. It takes at least 2 weeks. You have to be in a depressed mood more days than not, and it is a very deadly disease. And it's not something that can be seen under the microscope. That is why mental health, even though psychiatry, it's all under the same umbrella and it's all medical, is still seen differently than if someone has cancer. There are support groups for cancer, and if someone's diagnosed with cancer, everyone stops and pays attention to that person, and rightfully so, but it should be the same for depression because cancer has a cure. Cancer has all these treatments, which again can be measured. And while depression can be measured by, for example, there's the Beck Depression Inventory. It helps me to moderate someone's progress through therapy. When I diagnose, for example, major depressive episode, it would be mild, moderate, or severe. Excuse me. And so if it's severe, that can cause psychosis. And I always use the most uh, up-to-date, research-proven, empirically, which means verified by other experts and research teams, methods of treatment. The number one proven treatment for depression is always, always, always therapy using cognitive behavioral therapy, for example, and seeing your doctor or psychiatrist or both for medication management. That is your number one regiment to fight the war of the mind. That is what I call it. I'm very familiar with the war of the mind. I have had PTSD, depression, OCD. That is why I became a therapist, is because I overcame. I know what it's like to be in the dark. I know what it's like to overcome. I know the feelings. I know. So when a patient comes to me, it doesn't take long to know where they're at. People come to me and sometimes they don't know what's going on. Sometimes they come with a different issue, but there's maybe an underlying issue that's much bigger, and they're just self-awareness is huge in therapy, and that's basically what therapy is. Therapy is like a mirror. It is getting to know who you are, even if it's family therapy, marriage therapy, whatever it is. So depression left untreated, a lot of people drink when they're depressed, which is obviously uh, it's an antidepressant, which makes you feel worse. And then there's the guilt of drinking because you could turn into addiction, and that turns into a whole other monster because then you have to treat the addiction, which is um, how do you call it? A repercussion of untreated depression. It is so now you have, and there's also trauma because the trauma is any loss. So when you have an addiction, you lose your free will, and so what I'm doing here is connecting the dots, connecting the domino effect that a mental health illness can have. A mental health illness can lead to other mental health issues and essentially death. So, for example, say someone's depressed and they develop a gambling addiction, which is non-chemical. It is a behavioral addiction. And with gambling, how do people die? People like you can't overdose with gambling. So I've heard drug addicts state they're jealous of people with gambling because they get to go to casinos or go to card games or go to race horses. Well, underneath all that, after they get off the high, they're depressed. They feel guilty. They're traumatized. They've lost everything, and a lot of times they hang themselves. That's actually one of the number one ways they kill themselves. But you don't hear these stories on the news because for example, Las Vegas or uh, New Jersey, you give couples advice too. Yes, I'm answering questions. I apologize while I speak. Hi, Karina. Yes, that's marriage and family therapy was one of my specializations in graduate school, and That's, and I was going to get to that too. Couples advice, marriage, it's all the same thing. Relationship, pretty much the same dynamics. Let me just finish on. Uh, anyway, for example, Las Vegas, many people jump off the hotel balconies into their deaths, or people are murdered because of loan sharks. So as you see, addictions, which always have trauma underneath them, and this is just a 1 hour video. There's no way I can cover all the issues in mental health or what happens if untreated or treated, but I'm going to try to give you a snapshot. Since someone asked about couples advice, I will kind of touch on that. Relationship issues, I would say, are 40 to 50% of what comes into private practice. What comes in the ER is the depression, suicide attempts, homicidal thoughts, people that have overdosed, people that are have an addiction, don't know what to do,